Hello, welcome to the Supervision Basics module of the VPBS Supervisor Training. My name is Kimberly Weitzman. I am QA and Training Manager at ViaQuest, and I will be presenting this to you today. I want to thank Stacy Grano for putting the information together and researching this topic. So thanks to Stacy for her hard work. So our objectives for Supervision Basics today are to review some supervision myths. We will introduce supervision basics. We will identify important supervision points to keep in mind. And hopefully by the end, you will understand basic supervisor competencies. So we'll start with some myths about supervision. The first one is, if I am an experienced TBS worker, counselor, or social worker, I automatically will be successful and effective as a supervisor. This is not necessarily true because the skill set required for each of those jobs is significantly different, even though there are some commonalities. The tasks to be accomplished and the desired outcomes are different among those jobs. The next myth is true clinical supervision is strictly for the review of cases. If you give handouts or teach, that's training, not supervision. So that is a myth because if we are solely just reviewing cases, we're ignoring a key component of clinical supervision, which is that of professional development. Supporting your supervisee to continue to grow and learn is part of supervision. The third myth on this slide is if the supervision is not going well, it is the supervisee's fault. And this also is a myth because the responsibility for supervision going well rests both on the supervisor as well as the supervisee. The supervisor's role really is to promote the growth of their supervisee, the growth of the profession as well, to safeguard the profession and to ensure the quality of services for clients. Here comes even more myths about supervision. That supervision is only for beginners or the inexperienced. If you have to be supervised, you must be deficient somehow or incompetent. And that also is a myth because really supervision is desirable at all experience levels, basically to ensure quality of services that are being provided. The next myth is that because supervisors are professional, diversity issues do not have to be addressed. Diversity issues do need to be addressed. A competent supervisor is aware of these diversity issues and attempts to address them even in supervision. The third myth on this slide is that the best feedback is direct. Tell it like you see it. There is no need to coddle your supervisees. This also is a myth because the interaction within supervision is just that, an interactive process between two professionals, and only they can reach their own true potential when both parties are participating openly and fully. The last one on this particular slide is a supervisee's thoughts and feelings are not relevant to learning. That one also is a myth. Supervisee's thoughts and feelings are relevant to learning. We need to know how they're thinking and feeling about progressing in their career and learning new skills so that we can match their learning style, match what they're interested in learning, and be sensitive to how they're feeling being supervised as well as learning new skills in this profession. There's even more myths about supervision. The next one is that supervisors are experts. So it's important to make that clear and never admit to mistakes or that you don't know the answer. That one also is a myth. Supervisors as well as supervisees are both human beings. It's okay to acknowledge if you don't know something, But you do need to find out and be willing to guide your staff towards finding out the correct answer. The second one, because supervisors are totally responsible for the actions of their supervisees, the supervisor's directions should not be questioned. This also is a myth. There should be open and honest communication between both the supervisor and the supervisee, and hopefully the supervisee feels comfortable enough to ask questions or to ask for clarification from their supervisor. Again, keeping those channels of communication open. The third one on this slide as a myth is, in order to avoid a dual relationship and becoming your supervisee's therapist, you shouldn't use your therapy skills in supervision. That is a myth. Yes, you are in a supervisor relationship with your client, not a therapist relationship with your client. But a lot of those therapy skills that you already have will come in handy as you are working with your supervisee. Active listening will certainly be useful as you're getting to know what your supervisee is going through and their barriers and struggles. Reframing is certainly a skill that perhaps will help your supervisee to look at client situations in a different way. And so again, all of those therapy skills that you have, while you're not providing therapy, you're still using them as a way to communicate and really hear what your supervisee is saying and to understand what they are going through. Okay, so let's go ahead and give a definition of what even supervision is. The supervision definition that we're going with is that supervision is the process of reviewing and monitoring a practitioner's work to increase their skills and to help them solve problems in order to provide clients the optimal quality of service possible and to prevent harm from occurring. So within that definition of supervision, we're talking about several different things. We're talking firstly about quality control, meaning that the supervisor is responsible for monitoring the quality of services being provided by the people that you're supervising. You are really in charge of quality control, and quality services cannot be provided without regularly monitoring and reviewing the work of those that you supervise. Another component of supervision is training and development. Part of your supervisory function is to make sure that your supervisees are growing and developing into the best practitioner that they can possibly be, given their unique set of skills and talents. The third basic component of supervision is to solve problems. Hopefully, as a supervisor, you are leading your supervisee towards solving their own problems, but solving the problems and resolving a situation in a way that ensures, again, quality of services. The fourth basic of supervision is to prevent harm from occurring to clients. So please, be vigilant, be aware of any supervisee issues that could result in a client receiving an inadequate service or actually being harmed in the therapeutic process, whether the supervisee is intending that or not. The next one is evaluation as a component of basic supervision. You are going to need to evaluate your supervisee in many different areas. What is their level of professionalism? What is their skill as a diagnostician? What are their interpersonal skills? So we are constantly evaluating everything from their soft skills to their skills in documenting their progress notes and other forms of documentation. We may also need to be providing evaluation so that the supervisee can progress to the next higher credential or become independently licensed, for example, or continue on in school. So we may also be providing evaluation to other governing bodies. And the last basic tenet of supervision that you'll see on this slide is in regards to socialization. So we are modeling as well as instructing our supervisees in how to interact with clients, how to present themselves in a professional but therapeutic manner as far as how they talk, how they dress, how they act in session, how they interact with other professionals, as well as how to handle certain situations such as seeing a client outside of session, perhaps at the grocery store or something. So in all areas pertaining to social interaction, part of the basics of supervision for sure. So some more ideas about the basic of supervision, thinking of it as being the process of moving your supervisee to the next level of attainment of skills, which involves perhaps you providing training or suggesting trainings that would be especially helpful to them, acting as a mentor, as well as you yourself modeling competent service delivery. So this might look like attending a formal training. It could look like providing daily feedback on documentation or case reviews. We may be kind of reshaping perhaps habits that clinicians have picked up along the way, making sure that we are working with our supervisees to refine their approach and their techniques that they are using in delivering the variety of services that they provide to their clients. Okay, some very important things to remember regarding supervision. The reason for supervision, again, is to ensure quality client care. The primary goal of supervision is to protect the welfare of the clients and to ensure the integrity of clinical services. Another important thing to remember is that supervision is really all about the relationship. As in providing counseling or TBS services, just as you're developing a relationship between staff and clinician, we're also establishing a relationship between a supervisee and supervisor to promote a good working relationship. Third point here on this slide, culture and ethics influence all supervisory interactions. So there are many contextual factors going on in the supervisory relationship as far as culture, race, ethnicity. All of these will affect the nature of the supervisory relationship. And there are definitely models already established out there that are built primarily around the role of context and culture in shaping an approach to supervision. And so you're encouraged to research those as they might apply to your specific supervisees and relationships with them. Some more really important points to remember. Please be human and have a sense of humor. We are human beings, whether we're a supervisor or a supervisee. So please, be a role model and show that everybody makes mistakes. It's okay to admit that you made a mistake and hopefully learn from that mistake. The next tip is to rely first on direct observation of your staff and give very specific feedback. Really the best way to determine a staff's skills is to observe them directly providing that service and to receive also input from the clients that they're serving about their perceptions of the working relationship. The third point to remember is for you as a supervisor to have a sense of purpose. So model how you yourself provide clinical services. Before you can teach a supervisee specific clinical skills, you have to first understand the philosophy and the theoretical foundations on which you yourself as a clinician and as a supervisor stand. Staff need to know that what they are learning from you is based on a particular model and a particular theory as it relates to services and supervision. Some more things to remember, please make time to take care of yourself. Taking care of yourself spiritually, emotionally, mentally, and physically. Again, we are acting as role models as supervisors, and your supervisees are watching your behavior. So you might talk the talk, but do you also walk the walk of self-care? The next one is to advocate for the agency, for the staff, as well as for the client. So as a supervisor, you're put in a unique position to advocate for all three of those parties. But that also is an opportunity to assist in developing the skills in your clinicians, developing your team of staff, and then advocating also for the best interests of the clients, the best interests of your supervisee, and overall, the best interests of ViaQuest. Okay, so hopefully we have dispelled some myths about supervision. We've given you a good working definition of supervision, as well as provided you with lots of good information to keep in mind as you conceptualize being a supervisor and providing supervision. So now we will talk about the basic components of a competent supervisor and the skills that go in to being a competent supervisor. Want to think about having effective interpersonal skills, such as being a good active listener, providing feedback, challenging your supervisee when it's appropriate, and how to set boundaries within your professional relationship with your supervisees. You are demonstrating really your level of clinical skills, even as you're providing supervision, as far as your interpersonal skills that you're displaying. The next one is to be aware that supervision is a process, and we can adapt the way we supervise based on our supervisees' individual needs. We are, again, human beings working with unique other human beings. There may need to be some accommodations made, or we may need to change our style depending on who it is that we're meeting with at the moment for supervision. Please be able to assume a variety of roles and responsibilities. Being a supervisor is going to require flexibility to fulfill different roles and to wear different hats as you are acting as a supervisor, sometimes acting as a clinician in other aspects, and maybe even taking on other responsibilities. The last one on this slide is to stay focused on the fact that the primary goal of supervision, again, is to monitor clinical services. That is the reason that we are providing supervision, making sure that there is quality in the services that your clinicians are providing. Some more basic components of being a competent supervisor are being willing and relatively comfortable with serving as an evaluator, performing an evaluative function, and providing feedback. Some ways that you can do that is to clarify roles and expectations. Be sure that you are accessible and available to your supervisees, that you communicate directly and effectively, and that you are creating a safe learning environment where your supervisee is comfortable to learn new things, to try out new skills, as well as to ask you questions. You as a supervisor need to have knowledge of applicable laws, ethics, and professional regulations. Not just knowledge, but as well as modeling appropriate ethical behavior. Being personally and professionally mature. Having an awareness of your personal power that you really have as a supervisor. Being sensitive to cultural issues. Demonstrating empathy and respect and genuineness with your supervisees. And again, one more time, having that sense of humor when you're working with your supervisees. We want to make sure that we are documenting the supervisory activities that you're engaging in. Many supervisees report not knowing when their supervision would occur and felt that their supervisor made it a low priority. And so documenting it can ensure that we have a record of the supervising that you have provided, when and where it happened. We want to empower our supervisees through teaching, modeling, and problem solving. Again, creating that safe learning environment, creating that professional yet warm relationship with your supervisees to allow for learning to occur. Okay, so now Stacy has provided us with some good tips for being an effective supervisor. The first one is to learn the organization's policies and procedures. If you yourself are going to be teaching your supervisees about policies and procedures or enforcing policies and procedures, you yourself need to know what they are and what they mean. Please take time to learn about your supervisees. Ask them how they are doing. Be curious about what their experience is at ViaQuest. If they're comfortable sharing, asking them about their family life or other interests that they might have outside of work. Perhaps we can help our supervisees to find a mentor, either within ViaQuest or perhaps another professional, even outside. And you yourself might want to shadow a supervisor that you respect to learn from other supervisors how they conduct themselves and how they run supervision. Please, be open to training in supervisory procedures and methods. Search out local trainings that might help you to learn more advanced skills. In the back of your mind, be often asking things like, how am I doing? And how can I improve my performance as a clinical supervisor? Just as you're helping your supervisees to improve, you yourself should also be working towards improving your skills as a supervisor. And the last one here on this slide is to seek supervision of your supervision. Get a second opinion almost on how things are going in supervision from your own supervisor. You want to work to establish a contractual relationship with your supervisees with clear goals, as well as informing them of the method of supervision that you will be using. Think about learning methods to help staff reduce their stress, to address competing priorities as far as work-life balance. You're going to need to learn methods to resolve staff conflict, as well as interpersonal issues in the workplace. So you want to think about some barriers to the development of the supervisory relationship. If you are an experienced supervisor, think of examples of supervisees with whom it was unusually difficult. If you are just starting out as a supervisor, draw upon your own personal experience of having been supervised and think about what facilitated and what inhibited your relationship with your supervisor. Perhaps even as this training is going on, make some notes and make some examples of your experience so you can use them later in order to gauge whether you had difficulty forming a relationship or whether it was something that happened after the relationship was established. Think about what is the role of perhaps multicultural factors or of multicultural intersections of clients, supervisees, supervisors within the supervisory relationship. So some self-reflection on your own supervision might help you to learn from that, as well as you yourself become a supervisor. Okay, so next we will talk about how to structure your supervising sessions. And we have some great tips here again from Stacy. So in the first few sessions, some helpful practices could be to describe your role to your supervisee. If you have a brand new person to the field, maybe this is their first experience with supervision. They don't know what to expect from you. They don't know what you expect from them. So please take some time to describe what supervision is, what your role is, how you conduct supervision, what your model is that you're using. Explore your supervisee's goals for supervision. And if they don't know, we may have to help them to create those goals. And you're going to want to explain the difference between supervision and therapy. Just as we learned several slides earlier, we are using our therapeutic skills within supervision, but we are not providing therapy. And it would be helpful to explain that difference to your supervisee so they don't get confused. Again, as you're structuring the first initial supervision sessions, you want to work to establish a climate of cooperation, collaboration, trust, and safety within your relationship with your supervisee. Please discuss the legal and ethical expectations and responsibilities of supervision. And we're actually going to get to those a little bit later in this presentation. And think about taking time to decrease the anxiety associated with being supervised so that you can build a positive working relationship. Think back to the first time you met with your supervisor and what feelings that brought up for you. That may help you to ease the anxiety of your own supervisees if you're sensitive to that. Okay, so let's talk next about rights that supervisees have. This is called the Supervisee's Bill of Rights. So every supervisee has the right to a supervisor who supervises consistently and at regular intervals. Every supervisee has a right to a growth-oriented supervision that respects their personal privacy. Every supervisee has a right to supervision that is technically sound and theoretically grounded. Every supervisee has a right to be evaluated on criteria that are made clear in advance and with evaluations that are based on actual observance of their performance and not hearsay or rumors. Every supervisee has a right to a supervisor who is adequately skilled in their own clinical practice as well as trained in supervision practice. Hence why you're taking this training and hence why you also have a supervisor. So it might not be a bad idea to perhaps even go over this Bill of Rights with your supervisee so they know what to expect and they know what they're entitled to. Okay, so we very well may be supervising clinicians, professionals who are experiencing burnout and compassion fatigue. So here's some great tips to approaching that if that tends to come up in supervision. So the first step is to first help your supervisee to identify what the problem is, to problem solve as far as what is adding extra stress to their life, to their plate. We want to look at helping staff to find self-care tools that specifically address their experiences and their preferences for self-care. As a supervisor, you can absolutely assist your staff in adopting lifestyle changes to increase their emotional resilience and decrease burnout and compassion fatigue. We want to think about what is going on in our supervisee's world. Is it family? Is it friends? Is it work? Is it travel? And problem solve with them on ways to decrease those stressors, as well as encouraging them to have time alone for self-reflection, as well as making good habits in activities that re-energize them, perhaps exercise or meditation or other hobbies. Some other ways that we can address burnout and compassion fatigue is to help your supervisees eliminate those thoughts of what if and negative self-talk in regards to their work. Help them to let go of their superhero complex, help them to let go of their idealism, maybe perfectionism, and the idea that they can save the world. Help them to have more realistic goals for themselves. We can certainly help our supervisees to set parameters on their work. If possible, help them to stick to their schedule, take their lunch away from their desk, maybe even go for a walk at lunch, set realistic and reasonable deadlines for completing their work, as well as keeping work away from their personal time. We want to teach and support positive work habits. So some supervisees might lack basic organizational skills, teamwork skills, phone skills, or time management skills, things like ending sessions on time, starting them on time, as well as scheduling time to complete documentation. This is another role of the supervisor, is to develop these skills in your supervisees to help them reduce that daily wear that really erodes their emotional well-being and leads to burnout. Ask them perhaps questions like, when was the last time you had fun? When was the last time you felt fully alive? When people are burnt out, it's hard to have fun. It's hard to feel alive. This could be an indication that they are suffering from burnout and compassion fatigue, and they just don't realize it. We can do things with our supervisees like writing a list of things that they like about their job or things that they're grateful about regarding their job. Perhaps prompt them to make a list of 5 people they care about and love. Maybe making a list of 5 accomplishments that they're proud of in their professional life, or exploring with them where they want to be in their professional life within 5 years. So again, we're not providing therapy, but we are working on these skills to decrease burnout, decrease compassion fatigue, and help them to be better clinicians by taking care of themselves. All right, so now we're going to move on to ethics in supervision. So first of all, before we get too deep into ethics, a distinction must be made between supervising legally and supervising ethically. Oftentimes, ethics demand more from a professional than just simply adhering to state or federal statutes and regulations or policies of the agency. Licensed clinicians also have to adhere to the ethics of their particular board. And so we should be familiar with what those are. But some main ethical concerns for supervisors tend to fall into these areas. The first area is that of competence. So the definition of competency to supervise varies from discipline to discipline, but they usually have 3 main components: that you have a formal education in the area in which you're supervising, you've received professional training, and that you have you yourself have carefully supervised experience, so that your skills and strengths and areas needing improvement are known to you. The next main ethical concern for supervisors is that of due process. Please remember that your supervisees need to be informed of their rights that we talked about, as well as the appeal process that is available to them if they're in disagreement with any aspect of their supervision, or if they feel as though they are being treated unfairly. Another ethical concern for supervisors is that of informed consent. So as a general rule, informed consent allows for elucidating expectations of your supervisee, identifying and agreeing upon goals that you'll be working on in supervision, anticipating any kind of likely difficulties, as well as identifying the problem-solving process in advance. We want to keep in mind as well confidentiality, that the supervision that you're providing does have an element of confidentiality to it. We need to maintain our supervisees' confidentiality, as well as the confidentiality of the clients that we are discussing. So confidentiality applies both to clients as well as to the supervision that you are providing. And then the last ethical concern on this slide is that of multiple or dual relationships. So supervisors have the responsibility for closely scrutinizing and monitoring the relationship that exists between them and their supervisees to prevent harm or exploitation. Supervisors should evaluate their social interactions with supervisees to make sure that no harm or favoritism exists in that relationship. So here are some ways to provide ethical supervision. Please, as a clinician, yourself, be trained and competent. Provide a thorough orientation to your supervisees. Give them a tour, introduce them to their coworkers, introduce them to the administrative staff, let them know where the bathrooms are, let them know where the copy machine is, help them to feel as comfortable as possible so they feel prepared to do their job to the best of their ability. Be up to date on the current ethical codes that apply to your discipline. So you can then educate your supervisees on those current ethical codes. You also want to have goals for supervision. Your supervisees should know what they're going to be working on when they meet with you on a regular basis, so they know what to expect and they can be prepared for those sessions. You want to create plans and structure for supervision. Just like we create plans and structures for our sessions with our clients, the same thing applies when we're meeting with our supervision. So we can work on those particular goals and have a particular goal in mind as to what we want to accomplish with our short time together. Definitely setting up regular supervision can be beneficial so that it's not just responding to crisis that your supervisees may be having, but hopefully preventing crises from happening. So having that regular schedule will support you in that. Plan ahead for evaluation criteria and methods, perhaps even giving your supervisee the criteria that they will be evaluated on ahead of time so they can know what to focus on. They can know what they're going to be being evaluated on. Please be comfortable or get comfortable having dialogues about some uncomfortable situations such as dual relationships. Also, be ready to have dialogues about multicultural issues. These might be on the minds of your supervisees, and it's up to you as a supervisor to facilitate those discussions. You definitely want to be treating all of our supervisees with dignity, respect, and honesty, just as we would expect them to treat us with dignity, respect, and honesty. As a supervisor, conduct yourself in a manner that models and sets a good example. And be mindful of reinforcing appropriate behaviors. When your supervisee conducts a particularly successful session or meeting, let them know specifically what they did well to reinforce those skills and the behavior that you saw. We want to uphold the highest professional standards. And in order to do that, we first need to know what those professional standards are, as far as job descriptions, as far as our duty to state regulations, to federal regulations, as well as to our specific discipline. Please don't be afraid to seek your own professional help and guidance. Remember, you also have a supervisor. You have colleagues that are there to help you, just as you are there to help and support them. We want to adhere to the standards and regulations of confidentiality as it applies to our professional relationship with our supervisees. And just as with our clients, also with our supervisees, document, document, document. If it wasn't documented, it didn't happen. All right, so you might be wondering, how do I even evaluate an ethical situation? How do I make a decision regarding an ethical situation? Stacy has provided this graphic that I think really breaks down the process into easy to understand steps. So we'll go step by step through this slide of how to perform ethical decision making. So the first step in ethical decision making is just to recognize the ethical issues by asking whether there is potentially something harmful personally, professionally, or clinically going on. In what way could this situation go beyond a personal issue to affect the agency, to affect the profession that we're in? So once we have recognized that there is an ethical dilemma going on, we next want to get all of the facts. What are the relevant facts? What do we know? What do we not know? And identifying at this point who is affected by this decision that we have to make. What are all of our available options at this point? And have we consulted with all of those parties that we need to consult with at this time to get those facts? After we've recognized the ethical issue, after we've gathered all the facts that we can, we now want to evaluate all of those facts in that situation by evaluating alternative actions through an ethical lens, thinking about and weighing which options will produce the most good as well as cause the least harm, what actions most respect the rights of all parties involved, what actions treat everyone as fairly as possible. After we have evaluated all of that information, we want to ask, and that means to consult with a trusted colleague or a supervisor. If you told somebody that you respected what you did, how would they react might be another way to evaluate the ethical decision that you're going through. So after we've done any consultation, if necessary, make a decision and test it. Again, thinking about how would your supervisor react if you told them the decision that you made. And then we're going to actually put this into action, act on our decision, reflect on it later about the decision that we made, and think about if we had this to do all over again, what would I do differently? We want to learn from going through this ethical decision-making process. This is how we get good at making ethical decisions. We make them and then we learn from them. We make some more and then we learn from them again. It's an ongoing process because there are so many different kinds of ethical decisions and ethical situations that we might find ourselves in. We can't always know everything there is to know when it comes to ethics. Okay, another useful tool that Stacy has provided in this PowerPoint is a decision tree, which helps us to decide how to address potential legal or ethical violations. So I know that is very hard to read. There is a lot of small writing, so I have enlarged it on a Word document. So I will share that with you in this way so you can read what it says. So what we have here is like I said, a decision tree to help you through evaluating a potential ethical violation or perhaps a legal violation. So we start with some questions to ask yourself. Was there a duty to warn or a duty to act situation in which the professional failed to respond? Was there an unrecognized duty to report as far as a dependent, a child, a vulnerable adult? Was there abuse that occurred? Was there a breach of confidentiality? Did an inappropriate or unprofessional action occur? Was there a duty to act, and was the professional derelict in performing that duty? If you're able to answer all of those questions with a no, we don't need to continue because there is likely not a legal or ethical violation. But if you answered yes to any of those questions, we want to move on to identifying potential risk factors. And we're going to ask ourselves even more questions now. Questions like, are there clients or identifiable others in any dangerous situation as a result of this potential legal or ethical violation? Is there anyone in immediate danger? Is anyone at risk of harm? Was any damage incurred or might damage be incurred as a result of this action or maybe inaction? And could a professional's action be perceived as inappropriate? So once we've evaluated those potential risk factors, we may feel that there is no serious risk if we have answered no to those questions. If we have answered yes to some of them, perhaps there are some risk factors, Or if we have answered yes to all of them, there are significant risk factors. So we want to keep going if there is some or significant risk factors by doing the following. By identifying warning signs. For example, a client's propensity to commit a significant crime, the extent of breach of confidentiality, a boundary violation that might adversely affect the therapeutic relationship, as an example. We want to identify potential damage. For example, who might be harmed as a result of this action or inaction? Are there legal or ethical issues that might affect this professional, administrators of the agency itself, the profession? Was there a breach of the organization's crisis management policy or drug-free workplace act? Again, why it's so important to be familiar with policies and procedures. And then we want to monitor those warning signs. Maybe we are contacting all of those affected parties involved. It may be appropriate to notify relative authorities, such as Child and Family Services or law enforcement authorities. So if we have identified some risk factors, we're going to go this route by assisting the professional in identifying corrective steps. We will intervene with the client if necessary. We'll review damage control steps with your constituents. Going forward, verify and document that action was taken. And then finally, verify that the situation is resolved. If we have identified significant risk factors, we want to inform management or perhaps the professional board that we report to. We're going to begin disciplinary action against that professional if necessary and inform the state ethics board. Again, verify and document that action was taken. And finally, verify that the situation is resolved. So this is a great handout that really details what goes into your supervisor's role if we think there is a potential legal or ethical violation. I'm going to go ahead and put this on the O drive so that you can access it if you feel as though it would be helpful to have it in the future. So we're going to go back to our PowerPoint. And our next topic now is about balance. Because supervisors can often feel caught in the middle, because an effective supervisor plays a dual role. They are a clinician often, and they are also a supervisor. So we need to understand the rationale of both administrators as well as frontline staff. Think what it was like for you to start at the bottom. What was it like when you first started out in this field? That will help you to understand the perspectives of those above you, so to speak, and those below you, so to speak, those that you report to and those that report to you. So as a result of that, we may be introducing changes in our clinical practice. So we need to be respectful of any kind of resistance that staff might have, because change is hard for everybody. Show respect for supervisees and for the experience that they bring. Depending on who you're supervising, you may need to be flexible yet firm in your approach to supervision. And one more time, recall when you were in a supervisee's role and perhaps how you experienced a resistance to change. Change is hard. Change is not easy really for anybody. So being sensitive to that resistance will help your supervisees perhaps to understand the rationale behind the changes that are needed so that change can actually occur. So again, continuing this idea of balance, how do we balance clinical and administrative functions? One way is to be clear about the hat you're wearing at that particular moment. Are you speaking as an administrator, or are you speaking as a clinician? Be aware of your own biases and values that may be affecting your administrative decisions. Do some self-reflection into your own thoughts, your own feelings around the situation. a great way to get some objectivity is to get input from others to be sure of your perspective on the situation. Okay, so moving on to legal principles in supervision. There are 5 general legal principles. We'll talk about each one of them, and I'll give you a little explanation of each one of these. The first one refers to standard of care, which is the expected practice performed in a given situation by a given group of professionals. So this is why you only supervise within your area of competency. So you can provide appropriate feedback on evaluation, you can provide consistent monitoring and controlling of supervised activities. You can accurately document the supervisory activities and provide consistent and timely supervision because we are all within the same discipline. The next one is statutory liability, which is specific written standards with penalties imposed written directly into the law. As an example, malpractice is considered professional negligence. And there's a good definition after this: negligence, when one fails to observe the proper standard of care, not providing that service, not making that referral, not following up with crisis services, not reporting instances of abuse, neglect, or exploitation. Those could be examples of negligence. Direct liability is being responsible for your own actions or authority and control over others. Things like erroneous, improper, or unethical actions or omissions on the part of the supervisor. The 5th one is vicarious liability, which refers to being responsible for the actions of others based on you being in a position of authority and control. So keep in mind that as a supervisor, you may be liable for the actions of those that you supervise. So we'll talk about how to consider or to determine if a staff you supervise has acted negligently. Here are some guidelines. Think about, was there a duty to perform an action as established by the nature of the relationship between your supervisee and their client, or by a specific statute that governs that relationship? Was there a breach of the established duty, a violation of the standard of care that was foreseeable and unreasonable? The 3rd one is there a direct causation between the breach of duty or care that was the direct or proximate cause of the injury? And the 4th one, did damages occur as a result of the action or inaction of the supervisor, as far as physically, financially, or emotionally? We also referenced malpractice earlier, so we'll get some more details about the 4 criteria for malpractice. What needs to be present is a personal relationship was formed between the supervisor and the supervisee. There is a demonstrable standard of care for supervision and the supervisor breached that standard. The supervisee, or perhaps even the client, suffered demonstrable harm or injury, and the supervisor's breach of duty to practice within the standard of care was the proximate cause or reasonably foreseeable of the supervisee's or the client's injury. So how can we manage these risks? We'll go over some risk management strategies now. Here are some steps that supervisors can take to minimize potential liability. We first want to ensure that a supervision contract is in place. This is why at the beginning of a supervisory relationship, we're talking about expectations and goals, but not only just talking, but also making a written supervision contract. When assigned a new supervisee, make inquiries to determine if there are any special concerns about a particular supervisee. If possible, maybe talk to their previous supervisor. Follow up on complaints or concerns about a supervisee promptly and thoroughly. Again, document steps that were taken to resolve the problem to decrease further risk. As a supervisor, establish and maintain appropriate supervision boundaries. When a supervisee is providing services associated with increased risk, more intensive supervision may be appropriate. Nothing says we can't meet more often if it is needed on their particular caseload. Please review charts of clients while you're in supervision with your supervisee, clients that are currently being seen. The best way to do this is to follow scheduled chart review guidelines. Some other ways to minimize potential liability is to establish regular days and times for supervision and adhere to them. If your supervisee knows when supervision is going to occur, again, more likely they can plan for it and be prepared for it and make best use of their time and your time. Establish routine guidelines for supervisees related to the management of suicidal or violent clients. This may be an issue that your supervisees are coming to you on a regular basis, and you'll feel more prepared if you yourself have a plan of action for how you approach guiding your supervisees through clients that are having suicidal, homicidal ideations, etc. We've said it before, we'll say it again, document all supervision sessions. Take your own notes, as well as encouraging your supervisees to take their own notes as well, so they can reference them once supervision is over. Please maintain and review written policies. They do become updated, oftentimes yearly. So please make sure you are reviewing the most updated version of a particular policy and are familiar with any changes that have been made. Other ways to minimize potential liability is to monitor your supervisee's competence through work samples. Not only their charts, but sessions and perhaps surveys completed by their clients. Be accessible and dependable. Having an open door policy, allowing your supervisees to call you or to come to your office or to email you will help communication to be more fluid and ongoing. Consult with others as is appropriate. You have your own supervisor, you have colleagues. Please consult with others as needed. Be familiar with the laws and administrative regulations as it applies to your discipline. And please don't be afraid to discuss ethics with your supervisees. What a good way to minimize liability if we are all talking about ethics openly. All right, so moving on to evaluation. Supervisors are ethically bound to provide an impartial, objective, and accurate evaluation of their supervisees. Supervisees are legally entitled to receive an unbiased and objective evaluation of their skills and performance. Supervisors must understand that evaluation is an ongoing process, not just one event. For example, not just at their one-year performance evaluation. So we can provide continuous evaluation by supervisors because it is an opportunity for remediating a particular skill deficit or improving specific aspects of performance before they continue in treatment with perhaps other clients or with the current client that they're working on. It allows us to catch it earlier rather than later and make improvements. So like I said, evaluation is an ongoing process. It will help to establish goals and objectives with your supervisee, spelling out specific criteria on which the supervisee will be evaluated, even giving them a copy of the written evaluation that you might be using that they can expect to be evaluated on. Supervisees should receive ongoing feedback as to how they are performing on these criteria as a regular part of their supervisory sessions so that it doesn't come as a surprise to them once or twice a year regarding the feedback that they're getting as far as their performance. So we might want to provide more formal feedback at set intervals, maybe monthly, perhaps quarterly, so that your supervisee knows when to expect them. Supervisor should document that the supervisee has been made aware of their level of performance. This may be more essential in those situations where the final evaluation is going to be negative or critical. This can eliminate any surprises in an evaluation. So here are some tips for evaluation. Supervisees prefer clear expectations from the beginning and perhaps reviewing them on an ongoing basis. If you can provide written feedback, please provide it in a written form so the supervisee can refer back to it multiple times. Supervisees prefer encouragement. They want support. They want opportunities for self-evaluation. They want to improve. They also want specific suggestions for change. So talk about specific documents or specific areas on documents that they may be struggling with, reference specific therapeutic interventions that may be difficult for them. Try to be as specific as possible so they can make those changes that you're talking about. As far as feedback, as we are evaluating our supervisees, feedback should be frequent. Every time you meet with your supervisee, give some feedback. Or even more often than that, send an email, give a phone call to give some feedback. Feedback should also be as objective as possible. Keep it to the facts. Don't put your opinion or hearsay into it. Keep it objective. Feedback should be consistent. Your supervisee should know that they will be receiving feedback from you on a regular basis. Feedback should also be credible. Again, we don't want to give feedback based on rumors, based on hearsay. Keep our feedback or our evaluation based on what you saw the staff doing, what you read in their documentation, or even what they, or even perhaps maybe what a client has evaluated on a survey, for example. Think about your feedback being balanced. We don't want to only be giving negative feedback, we also want to be giving positive feedback. Definitely your staff are doing things well, in addition to needing support or guidance in other areas of their work. Feedback should also be SMART. SMART stands for specific, measurable, attainable, realistic, and timely. So again, giving specific feedback on a particular intervention or an interaction with a client. It should be measurable. Maybe we're talking about length of session, or maybe we're talking about number of sessions. Somehow, how can we measure this? Feedback should be in regards to an attainable goal. Is it possible for your staff that you're supervising to meet that goal in the feedback that we're talking about? Is it realistic that your staff can be doing what we're talking about as we're giving feedback? And it should be timely. Try to provide feedback as soon as possible after the incident has occurred, whether it was some positive feedback that you're giving or some negative feedback that you're getting. I believe our last topic now is in regards to leadership. As a supervisor, you absolutely are acting as a leader. So first, talk about qualities of a good leader and how to demonstrate that you are a leader. You aren't just a leader, you have to act as a leader and demonstrate those skills. So a good leader takes responsibility for their decisions. They put the well-being of their supervisees as well as the agency above their own personal accomplishments. Good leaders take appropriate risks. Risks aren't always a bad or dangerous thing. Risks are trying new things, or maybe pushing your supervisees to try new things or something slightly out of their comfort zone. Good leaders protect and advocate for their supervisees. And a good leader also does not play favorites. Everybody does have their own individual needs and quirks, but it should be clear that you're treating all of your supervisees as closely as possible in the same manner. Okay, so this has completed the basics of supervision module for the VPBS supervisor training. I appreciate your attention. I know that was quite a bit of information. I hope it got you thinking about how to approach becoming a new supervisor. Again, thanks to Stacy Grano for providing all of that great information and compiling it for this presentation. You have completed it. Thank you so much.